Which are the predictors of reduced quality of life? You have here a table, a list of them. You know them very well indeed. Depression, demoralization of hopelessness, cognitive impairment, lack of autonomy, lack of support, pain, fatigue, anxiety, communication difficulties, rapidly progressive disease, low self-esteem. Look at this, weak influence on the quality of life. Long duration of disease, neurological symptoms, forced unemployment, MRI disease burden. This is very interesting, for the neurologists at least. These are weak predictors for the quality of life. Let me show you one recent paper again about prediction of anxiety and distress following diagnosis of MS. These authors wanted to investigate the course of anxiety, depression, and disease-related distress, which are very important factors for quality of life, in a cohort of recently diagnosed patients and their partners. So the conclusions of these studies were that MS patients and their partners continue to have high levels of anxiety and distress in the next first years after diagnosis. Therefore, the screening for anxiety after diagnosis can be used to predict levels of anxiety and distress during the 2 years follow-up. That means if after a diagnosis you feel that the patient has anxiety, has distress, and the family also, you have to follow them carefully, because probably in the next 2, 3, 4 years they will keep the same way. So they will have anxiety, they will be distress, and we have to take this seriously, because the quality of life is going to be very reduced. Just very few slides about coping and skill, some suggestions that you know very well. Maintain normal daily activities as best as you can. Well, you know, how many masters are you doing now? These sort of things, yeah. Stay connected with friends and family. Continue to pursue hobbies that you enjoy and are able to do. Get enough rest if you need it. Fatigue is very common in patients with MS. Exercise. If you can do it, exercise, because you have a mild or a moderate multiple sclerosis. That's a very good idea. It improves fatigue. It improves your mood. So exercise is really a key element, in my opinion, to treat or to manage patients with multiple sclerosis. Swimming, of course, is a good option for people who has problems with head or with mobility. Be careful with head, you know that. Not all patients hate head, but still be careful with that. Cool down, eat a well-balanced diet. Don't do very strange diets which have not demonstrated anything good in a serious study. So just a nice, healthy diet. Physical and occupational therapy, important, very important. I think this can help you very much indeed, sometimes from the very beginning. The other one is counseling. Somehow changed her mind, if I understood well. At the beginning you said, I don't believe in psychologists. But then you called to the Danish MS Society and you were relieved by the psychology there. So sometimes counseling, individual or group therapy, may help you coping with MS and also relieve emotional stress. The family and the caregivers, perhaps they also need that. And let me, talking about this, let me just show you this Cochrane database study. They wanted to assess the effectiveness of psychological interventions for people with MS. They review quite a number of studies, databases, these sort of things that Cochrane people does or do. And what they found is that the diversity of psychological interventions indicates the many ways in which they can potentially help people with MS. But not definite conclusions can be made from this review. However, there is reasonable evidence that cognitive behavioral approaches are beneficial in the treatment of depression and in helping people adjust to and cope with having MS. The two last slides. So how can we manage multiple sclerosis? Of course, you have to be in the center of the process. Everybody is around you. A neurologist, perhaps the less important piece in your management, at least after a while. You need social workers, you need psychologists, nurses, neuropsychologists, speech therapists, other medical specialties, occupational therapists, physiotherapists. You need all these professionals. But also, family is a key figure here to help you. That's very clear. And friends, not only to help you in difficult situations, but also to have fun with them. So that's mainly for young people, not for young people, because I'm getting older and older. So friends could be very nice for very different occasions. And of course, job. If you like your job, if you feel, well in your job, I think you should maintain as much as you can your job. And of course, association can help you very much. And I thank you, all of you, for your attention. Thank you very much.
Thank you for that, Xavier. Very, very interesting, comprehensive presentation on quite a difficult topic. And Sonia, for your introduction. Now, what about comments or questions to Xavier Montalban? Who's going to ask the first question? I realize the time is getting on. It's been a long morning. But if we had one or two questions, I'd feel I could close the session. Anybody inclined? No? I'm putting you under a lot of pressure, but no one is responding. And I think it's really lunch. Oh, right, good. So I think one question will probably be enough, but I suspect when one person gets up, somebody else will think of something. Sue.
You talked about diagnosis and how important that was when you first deliver it. And we all know how unpredictable the disease is. So how do you balance telling someone how bad it could be against how good it could be? They could be like me and still walking about with no, sort of visible signs. So how do you balance that when you have someone young like Sonia in your room? What do you tell them, and how do you get over this?
That's a very good question. First, I have to say that if I see a young person with quite a number of good prognostic factors, I feel very happy. I feel very happy because if I see a patient with an optic neuritis, complete recovery, the neurological examination completely normal, then I perform an MRI. The MRI has 4 lesions, small lesions, and increasing the T2 lesion load. I think that although, of course, I can be wrong, I can tell her, well, you have these good prognostic factors. So we have, in principle, we have to be optimistic. And on the other hand, as I mentioned before, we have options that we didn't